All right, it looks like it's 1 o'clock, so we'll go ahead and get things started. Good afternoon, and welcome to our weekly measles media briefing. My name is Casey White, and I'm a public information officer with the South Carolina Department of Public Health. We'll be joined by Dr. Linda Bell, our state epidemiologist, who will provide an update on the measles outbreak in the upstate. Following her presentation, she'll take questions. And with that, I will go ahead and turn things over to Dr. Bell to get started.
Thank you, Casey, and good afternoon, everyone. On Tuesday, the South Carolina Department of Public Health, or DPH, reported 6 new cases of measles in the state since Friday. That brings the total number of cases in South Carolina related to the upstate outbreak to 979. There are currently 91 people in quarantine and 1 in isolation. The latest end of the quarantine for these is March the 15th. From the new cases, DPH has identified public exposures at Willow Creek Gathers Homeschool Co-op, and we're still working to determine the number of individuals to be quarantined as a result of the exposure there. And additionally, 17 people remain in quarantine from Libertas Academy, and fewer than 5 people remain in quarantine from Mabry Middle School. The outbreak remains centered in Spartanburg County, with 927 of the 979 cases located there. And of our 979 outbreak-related cases whose vaccination status is known, 95% are unvaccinated. No vaccine offers 100% protection against infection, but the MMR vaccine has a safety profile proven over decades and is one of the most effective vaccines in preventing infection. It's been shown to provide lifelong protection against measles for about 90%, actually 97% of those who complete the recommended 2-dose series. Complications from measles infections are not reportable to DPH, but we have learned of 21 hospitalizations due to measles infections, including encephalitis and pneumonia since the beginning of the outbreak. And we're working closely with our hospital partners to learn of outcomes from measles infections. Hospitals are regularly reporting to DPH about measles hospitalizations, and we're confident that healthcare partners understand the seriousness of reporting these complications to us. From the beginning of the outbreak, controlling the spread of measles and protecting people from disease has been our primary objective, and I don't want anyone to miss that that is our priority. And so we're encouraged with the continued downward trend in new cases, particularly in the last 2 weeks. And no one should underestimate that the hard work and long hours that frontline, often entry-level epidemiologists have put into this response and are largely responsible for this downward trend that is actually occurring a bit earlier than previously projected. It is very important to point out, though, that this outbreak is not by any means over, and at this point in the outbreak, analyses of which measures best control viral spread in addition to vaccination, and that will help us inform others. So, for example, we have benefited from CDC's experience with other outbreaks since the beginning, and with our experience in South Carolina, we will share lessons learned from our progress, and we are requesting CDC to support us now for analyses that may include studies of chains of transmission, healthcare costs and public health costs associated with the response. But we still do need to focus on bringing up our vaccination coverage. And the measles vaccine is the best way to protect against ongoing spread, additional complications, costs, and disruptions from measles infections. So we continue to encourage anyone who is not yet vaccinated to consider getting vaccinated and filling the gap that we still have in achieving the best population protection to end this outbreak. The MMR vaccine is widely available in many primary care providers' offices and pharmacies and DPH health departments, and many children can receive vaccines at no cost to the family through the Vaccines for Children program or through their health insurance. DPH's mobile unit will once again offer the MMR vaccination to the public at no cost on Tuesday, March the 3rd from 10 a.m. to 2 p.m. at Grace Community Church at 570 Magnolia Street in Spartanburg. And with that update, I will turn it over to questions.
Thank you, Dr. Bell. And so most of you know the drill, but if you'll just raise your virtual hand, I'll call on you in the order in which you raise your hand. We ask that you will ask one question at a time. That way we'll have time to get through everyone's questions, but you're always welcome to re-raise your hand afterwards. And so we'll go ahead and get things started with Allison.
Hi, Dr. Bell. Thanks for doing this. You mentioned that you're encouraged with the downward trend, especially in recent weeks, and that this is earlier than might have been projected or expected. Can you tell us a little bit more about what some of the projections had been showing, what some of the modeling has been showing for this outbreak?
Yeah, a bit earlier in the outbreak, they were projecting that we might be involved with this for as long as 6 months. And so with this downward trend, what we're seeing that the case counts per week now are really down to the level that we were seeing at the beginning of December. And so we are now 22 weeks into this, and we hope with that continued downward trend, in parallel to the hope that vaccination coverage will increase, will help us end this sooner than was originally projected.
Thank you, Dr. Bell. And Tom?
Hey, good afternoon. So a lot of this on the ground work involved a lot of people working a lot of hours, I'm sure overtime as well. Has the department been able to cover this? Have you sought any additional funding? And I guess as part of that, can you speak about what support you're asking for from the CDC?
Sure. Yes, that groundwork has been vital to the progress that I just reported on. And we have the Department of Public Health, unlike in other settings, we are a centralized public health agency. So we have the ability to pull expertise from other areas in the state to support this response, to sort of realign the support. We've also had funding from the CDC that has allowed us to hire additional people temporarily. And so that groundwork, and as I mentioned, that our priority with controlling the spread of this virus by respiratory droplets, the groundwork that is most important in that often involves as I said, often entry-level epidemiologists doing that work. But at this point in the outbreak now, where we are in a position to begin to analyze lessons learned and do different studies, we will be requesting that kind of support, that higher level, more analytic support from doctoral level prepared scientists, physicians who are infectious disease specialists in some instances, to help us with the analyses of what we're learning, that as we have already benefited from the CDC, from what they've learned from other outbreaks, we can share that and they can conduct these analyses. And that's the kind of information analyses that we will be requesting.
Thank you.
Thank you, Dr. Bell. And we've got a question in the chat from Devi at AP. She asked, do you have any sense of what contributed to the earlier than expected decline? In addition to increased uptake of vaccination, is there any indication that there was a large amount of undetected spread that gave people immunity, or are people taking more precautions? Anything like that?
Well, I think an understanding of the principles of disease transmission has been very helpful. And so our ability to rapidly identify cases and recommend that people during their infectious period stay away from others, that our ability to interview those cases, find out about their whereabouts, try to identify potential sources of infection have been helpful. Identifying their close contacts so we can provide the guidance for remaining in quarantine. We know that a large number of people actually incubated out while they were in quarantine, which prevented many more public exposures. So it's really the focus on the basic principles, which has been our priority from the beginning, of preventing the transmission of a virus that is spread by respiratory droplets. We do not believe that we have seen a significant, that there is occurring a significant amount of unrecognized transmission. And then the other point is that we think our messaging has been successful in encouraging people to get vaccinated. I've previously reported on that significant uptake in vaccinations, particularly in the month of January of 2026 as compared to 2025 in the Spartanburg County area, in the upstate, and also in uptake statewide. So all of those things have contributed to what we understand about how to control the measles virus.
Thank you, Dr. Bell. And we've got another question in the chat from Carrie Beal, who's with Fox Carolina. She asks, does warm weather help decrease transmission of measles?
No, the measles virus has no really seasonal associations with it. It can be spread year round, regardless of cold weather, warm weather. It just finds susceptible people regardless of the weather. And so unlike other respiratory diseases that are seasonal, we encourage that people pay attention to this protection year round, and that unexpected exposures can occur at any time. So that's why we are emphasizing the importance of getting vaccinated now.
Thank you, Dr. Bell. I'm not seeing any other hands up. I'll give folks a second or two to raise their hands. There we go. Baker.
Hey, it's Baker Mossby with the Herald Journal in Spartanburg. I guess I don't know how many unvaccinated people or others lacking immunity there may still be in the Spartanburg area. And the uptake that you mentioned in January might alter whatever previous numbers I might have seen, based on the 45-day and updates of school numbers. But guessing that there are still quite a few unvaccinated kids in Spartanburg, what risk is there still, and what's different about the situation maybe now versus September, October, when there weren't many cases then, but obviously it grew? If there are still several hundred, I don't know, maybe even a couple of thousand young people who are in school but not vaccinated.
Well, maybe a helpful way to look at this is that there are pockets of the school level. We know that vaccination coverage varies significantly from one school to the next. So if a child is spending a lot of time in a school where the vaccination coverage is low and continues to be low, then the ongoing risk in that particular setting where that people are spending time is at a higher risk. And so we can level that up from these pockets that go from schools, from communities, pockets within communities, counties. We recognize from the outset that coverage in the upstate area of the state overall was lower as compared to other areas of the state. So all of those are contributors depending on where you might be. And it is really these pockets of high-risk communities that are under-vaccinated, whether that's at the school level, the county level, the area level, that will continue to fuel the outbreak and can result in cases breaking out into areas where there's actually higher coverage, but it can still find susceptible people in these other areas. And so we want to encourage that and continue to provide information as we can about the coverage levels where we started from, and let people know that there is a gap there that we have to fill to get that overall population coverage to achieve herd immunity that we had achieved in this country some time ago, to interrupt this outbreak so that the virus is not finding these pockets of susceptible people.
If I can follow up real quick, how much of a concern are those clusters? If it's in certain schools or certain churches, obviously the numbers have come way down, and the number of people in quarantine, is also way down. So all that looks good, but how concerned are you about a school or a church where there may be 70 or 100 unvaccinated kids, even still, today and for the foreseeable future?
Oh, they're very concerning because, as I said, that this is not over yet. It's not nearly over yet. And so it is these pockets of under-vaccinated people who, who remain susceptible. That ongoing susceptibility in our population may continue to fuel ongoing spread. So it is very concerning. And we, as even, the numbers of cases that we are seeing now, at the beginning of this outbreak, those number of cases per week was very alarming to us, and it still is. So even if we're only seeing a dozen or so cases per week, the risk that we can again surge remains. We know that we're moving into another, if you will, potentially holiday season, moving into spring break. So we would not want people out and about who are susceptible and exposed, and then going to tourist attractions or traveling or things like that, exposing others. So with those who remain susceptible and can be infected, this is a great concern.
Thank you, Dr. Bell. Oh, sorry. And Anna Mona?
Yes, hi, Dr. Bell. Thanks for doing this. Can you characterize these pockets that you're talking about? Can you elaborate on what that means a little bit? Are these people with religious exemptions? Are they people who go to the same school, the same church? Can you identify them in some way?
Well, as I mentioned, it varies from school to school, for example. So the level of religious or other exemptions in a school setting is an example. And as I earlier mentioned, when we look at areas of the state that might be more susceptible, we've seen the intense focus of this outbreak in Spartanburg County, and we already recognize that coverage in Spartanburg County overall was lower than other areas of the state. That's another example of a pocket. And then just people who tend to congregate together with the churches or whatever, and those and share social activities and things like that are other examples of pockets of communities that are under-vaccinated. And so all of those can be instances where people are at high risk of ongoing exposure.
And if I could ask a follow-up question, what do you do about those pockets? Do you target them specifically? Have you looked at religious exemptions, and how do you deal with somebody who says this is a violation of my religion to be vaccinated?
Well, what we do is we make sure that people are informed about the risk. And so through our messaging, we want to help people understand if they're in a community where there is an increased risk. We continue to promote the vaccination, the benefits of the vaccination, the safety of the vaccination. So the way that we're addressing this is by making the information available so that people can be informed, understand what their risk is, and make choices to be protected.
Thank you.
Thanks, Dr. Bell. And we've got a question in the chat from Michelle Smith at The Guardian. She asks, what role, if any, have school vaccine requirements had in this outbreak, and what role have exemptions had?
Exemptions have had a big role because even though exemptions are permitted, if a child has an exemption, but there's a case of a disease in a setting that they have not been vaccinated against, that child must still be excluded even if they have an exemption. And so school exclusions and quarantine have been very effective in preventing ongoing transmission within school settings, keeping people out while they're either infectious or when they are should be in quarantine because they can develop symptoms, mild respiratory symptoms of a runny nose, a cough that might not be recognized as the prodromal symptoms for measles, but they're still spreading the virus. So the importance and the effectiveness of quarantine and those exclusions have been very effective in limiting transmission in school settings.
Thank you, Dr. Bell. And another question from Allison.
Dr. Bell, on some of the modeling work that has been done on this outbreak, did you all have any estimates of what the potential population of susceptibles was in Spartanburg County, and sort of where we are at this point in terms of how many of those susceptibles have now contracted measles?
Some of the susceptibility has been part of the modeling. to help understand who's at risk.
But did you get any counts, like an estimate number of susceptible people, individuals within Spartanburg County?
No, but this is an example of where a further study could be done. And so we're not getting individual counts of people who are susceptible because people may have natural immunity, never documented that they've been exposed, people born prior to 1957 and things like that. It would not be possible to get individual counts of the number of susceptible people in a population for various reasons.
Okay, thank you.
Thank you, Dr. Bell. And it looks like we have one more question in the chat. Michelle said, to clarify, my questions were about vaccine mandates and exemptions from vaccines rather than exclusion from school, but I think those are kind of touching on the same subject.
Yes, I understood your question to ask both about the mandates and the effectiveness of the exclusion. So I did comment on the effectiveness of the exclusion. If you want to repeat your question about the vaccine mandates, that is, there are school entry requirements, and people also have the availability of getting exemptions.
And one other question from Allison Young in the chat. She asked, does DPH have a theory about why cases in other counties haven't ignited wider spread in those areas? And I think referencing cases in Lancaster and.
Well, as I've commented on, Spartanburg County is a county that has lower vaccination coverage than other counties. So those who are in counties with higher vaccination coverage have less likelihood of the being exposed to others who are susceptible and spreading the disease. In addition to that, many of the schools in Spartanburg County have some of the lowest vaccination coverage rates in the state. So all of those are contributing to the reason that the outbreak has been focused in Spartanburg County because of higher risk there because of lower coverage.
Thank you, Dr. Bell. And it looks like that's all the questions we have. So I'd just like to thank everyone for attending today. And thank you, Dr. Bell, for your time. As always, if anyone has questions after this call, you're always welcome to reach out to us at media@dph.sc.gov, and we'll follow up with you. And until next week, we appreciate you being here and have a great day.
Thank you, everyone.